Hello, I'm Dr. Josh Shields, and I'm glad that you're taking the time today to be with us and watch this seminar. I promise if you watch this seminar in its entirety, it will definitely change the way that you view health and especially the way that healthcare is being delivered today. So let me start off by asking a question. I know that many of you are currently going to your doctors regularly and getting your routine blood work done and taking whatever medications are given to you. And you might have even started eating less food and trying to eat healthier. And you might have even started trying to be more active. But is this all there really is to health? And when I ask that question to a lot of people, they answer with the answer of no, of course it's not, because if it were, you probably wouldn't be listening to this seminar today. And that's what's real important to understand is that today, in today's world, things have changed. We have more toxins, more chemicals. The foods that we eat are not even really food in some cases. We take more medications. We're under more stress, and so therefore, the healthcare model in which we're entering has to start evolving and start changing to understand that there's some new complexities to what's happening and what's affecting your health. And so that's why we're here, is to really explore and understand what is healthcare going to be in the 21st century and how can it be improved. Because I promise you, if your doctor's not taking into consideration the toxins in the environment or taking amount of toxins that are in your body is something that could be potentially affecting your health, then something's being missed. If we're not taking into consideration the fact that you probably have some nutritional deficiencies, and in many cases are often severe nutritional deficiencies, if those aren't being addressed, you're not going to reach your fullest potential, okay? So let me go back a little bit and explain who I am. My name is Dr. Josh Shields, and I initially became a chiropractic physician, and that's where I met my wife in chiropractic college. We both moved to Georgia, and after being in practice for 6 or 7 years, to be honest with you, I became quite frustrated because I really wanted to make a bigger impact. Even though I was still taking care of my patients' spines, I was still seeing them having troubles with things like autoimmune disease. I was seeing them have troubles with their thyroids. I was seeing them have to continue to take medications, blood pressure medications, cholesterol medications. I saw them having endometriosis, and I just saw all these problems, and I saw them still suffering, and I knew that there was a way I could help them with natural means, but I knew I needed to learn some more tools and some more skill sets. And so I actually embarked into continue my education to become a board certified functional medicine practitioner. I'm one of only 6,000, I believe, in this country right now that are practicing, that are board certified. And I know you probably have never heard that term before, but I know you've heard of Dr. Oz. And Dr. Oz on his show, he has what he calls his Fantastic Four functional medicine practitioners. And these are medical doctors that were once practicing medicine but have hung up, I like to say, hung up their stethoscopes or hung up their lab coats and picked up the new scope of functional medicine. And what functional medicine is, it's really, to really put it simply, it's looking to remove things in your body that aren't supposed to be there and put things in your body that you might be missing, like essential vitamins and minerals. So really that's what we're doing, is we're looking to remove things like toxins, remove things like bacteria, parasites, food sensitivities, anything that's causing an internal stress, and we're looking to replace the body with the right amount of essential fatty acids, vitamins, and minerals so that the body can start to repair itself and become whole again. If you look at this picture pretty much explains functional medicine. What we like to say is that there's a root cause to these problems, and if these root causes aren't addressed, the symptoms will start to appear. And if you notice here underneath the ground, under below the surface level, is where these causes are. And I think we can all agree that nutritional deficiencies can cause illness. I think that we can all agree that stress can cause illness. We all agree that toxins and toxic environment can cause us to be ill. Poor digestion can cause us to be ill. And so we have to look at these causes, because if we don't, eventually we start to see the surface, we start to see the symptoms that we then address in our current healthcare system with medications or surgeries. A good example of this is depression. I know this is going to sound like a crazy question, but how many of you believe that depression is caused because of a deficiency of Prozac? And I know that might seem a bit humorous, but if you really think about it, out of every 6 women in this country today are taking some form of an antidepressant. If it's not getting to the root cause of their problems, why are they taking it? And now what we're also seeing is that research is showing us that they've done two different groups of studies. They've put one group on antidepressants, they put another group on sugar pills, and after they did a long-term study, they found that the people that took the sugar pills over long term had less depression and were less chronically ill than the patients that took the depression medications. So if they're not addressing the true cause, why do we take these things? Well, because it helps with our immediate systems. It's a band-aid that can help, but it's not something that's going to long-term get us where we need to be. Another good example is 1 out of every 3 Americans now over the age of 60 is taking a cholesterol medication. Now we know that we don't have high cholesterol because of a deficiency of cholesterol medication. We know there's got to be a true cause, and the thing about it is that there's not one particular cause of high cholesterol, and which we're going to actually explain a little bit later, but one of the reasons of high cholesterol is because the body makes cholesterol. It's not actually what you eat. It's only 25% of your cholesterol levels are raised because of what you eat, but 75% of your cholesterol is actually because of what your body produces from its liver. So what's the body trying to do when it's elevating our cholesterol? Well, that's what we'll explain more as we go through this, but it's important to understand is if we keep addressing the symptoms, we're going to continue to suffer, because if you don't address the true cause, the problem will get worse. And that's what we see in our clinic all the time as patients come to us and they're on handfuls of medications, they've been suffering for years, and they're not getting any healthier. So we have to switch our paradigm and understand that we can help the body become healthy and whole if we just eliminate from the body what isn't supposed to be there and put in the body what it does need. Now in our office we like to look at the body as 4 primary systems. The body actually has, depending who you ask, 11 or 12 different primary systems of the body. Now unfortunately, many of us are used to going to practitioners that specialize in separate divisions of our body. For example, if you have a heart problem, you go to a cardiologist. If you have a gut problem, you go to a gastroenterologist. But the problem with that is that our body's really not separate systems. That our systems of our body are all interconnected, that they all work together in harmony, that we are one entire ecosystem. So for practical purposes, for educational purposes, we like to explain the body as these 4 primary systems. What I like to say is that these 4 systems are the 4 core systems of our body. When one of these systems become out of balance or become damaged, it affects the other systems. And so if you have a problem with the hormonal system, it's going to affect your nervous system. It's going to affect your detoxification system, and it's going to affect your digestive system. That you can't affect one system without affecting all the other systems. But realistically, that's why I consider them all one system. But for today's purposes, we're gonna go through each one of these systems and explain how these systems become broken and damaged, and then how they affect the other systems of the body. So the first system we're going to talk about today is indeed the hormonal system. In the hormonal system, we're going to be talking about your adrenal glands. Now, I know a lot of you are familiar with the hormone adrenaline. So therefore, you probably have a good understanding that when you're stressed, when you're under a lot of what they call attack, your body goes into a fight or flight system. And that's when these little adrenal glands that sit on top of your kidneys start to release certain hormones like adrenaline, cortisol, epinephrine, norepinephrine. And when this happens, what we start to see is a physiological change in our bodies. We start to see our bodies start to elevate our blood sugars. We see our blood pressure go up. And why that is because obviously, let's pretend a big bear jumps out of the woods at you and growls at you and scares you. Well, obviously you're going to want to fight the bear or run from the bear, and I promise you're going to want to run from the bear. When that happens, you have to have your blood pressure has to go up so that you can have more blood in your arms and your legs. You have to have more blood sugar so that you can run and be faster and be more active. Over time, though, what we see with this stress, with these types of stresses, is that eventually we develop what we call chronic fatigue syndrome. And then eventually, even sometimes we see fibromyalgia develop. And the reason we see fibromyalgia develop in these adrenal fatigue cases is because initially, if you think about it, when you're running from a bear, you could run through briar patches and you're not going to stop or even feel the pain until well after an hour after you're done running, because that's when the adrenaline wears off. That's when the cortisol wears off. And actually, cortisol is an anti-inflammatory hormone. So it actually helps buffer our pain in our body. Now, it's also important to understand that when I say the word stress, a lot of you like to think of stress as in the form of emotional stress. I always like to say, driving in Michigan, dodging potholes, or, going to work, or your spouses or relationships. These are all emotional stresses, but there's other stresses that we can encounter in our lives. And that's what we were talking about earlier, is when you have those hidden stresses inside your body, When you have those things that aren't supposed to be there, like the toxins or the chemicals or the hormonal imbalances or the yeast overgrowth or the food sensitivities, these are all hidden physiological stresses that also impact us and eventually lead to fight or flight. And that's why we're starting to see now also more people with anxiety and depression. If you think about it, if you're under long-term stress, doesn't it just make sense that eventually you're going to become depressed or become anxious? And so that's what our job is to help discover where the systems of your body are breaking, where these stresses are coming from, and how to help you learn how to improve your situation, eliminate those stresses. And I'm going to show you a little bit in the next slide how stress actually depletes some of your hormones that affect your mood. We're also going to crave salty foods and caffeine. I don't know about you, but I am a stress type. I have 2 businesses. I moved here from Georgia to be in Michigan, and I forgot to mention earlier, but I actually moved to Michigan to be closer to my wife's family. So we had 2 children then. We're about to have our 3rd, and we decided to sell my business down there, come back to Michigan and restart. And so I've opened integrative wellness centers where now we just simply practice functional medicine, but also in a massage envy, which is over off 6 Mile and Haggerty behind P.F. Chang's. So in that transition, I know a lot about stress, and I can promise you, when I go to the grocery store and I walk by those salt and vinegar potato chips, my mouth just starts to water because that salt actually is a precursor to a lot of those hormones that those adrenal glands release. So I have those cravings. And what I find a lot of times, if you have that craving for salty foods, those are also the same type of people that have troubles falling asleep or falling back to sleep. So those are the kind of people that will say go to bed at 10 but don't fall asleep till 11 and then wake up at 2 and stay awake from 2 to 3 or 3:30 at night until they fall back asleep. That's those adrenal glands kicking in and becoming dysfunctional, becoming damaged. Those people also are going to have anxious energy or heart palpitations, typically towards the middle of the day or the end of the day sometimes, or sometimes even the first thing in the morning they wake up and they just have this anxiety about them. They don't know why. They feel like something's wrong. Eventually, with long-term stress, we know that people develop heartburn, reflux, or ulcers. And it's interesting to think about that, but when your adrenals are firing, it actually shuts down your stomach. And you've seen this and heard this before, because if I told you that stress causes ulcers, you'd be like, yeah, it does. But this is the mechanism and how these adrenal hormones actually shut off your body's ability to digest food. It also shuts off your reproductive system, and that's called, so what's happening is it's shifting your body from the feed and breed system to the fight or flight system. And so that's also why we start to see people that have had a lot of stress when they go through menopause. They have a tremendous amount of troubles with their hot flashes and mood swings, and that's because the adrenal glands also release estrogen. So as the ovaries produce less estrogen, the adrenals are supposed to come in and be the hero. And so sometimes we can, or actually not sometimes, many times we're able to help our clients that were once thinking that they had to rely on hormone replacement therapy, but now once we were able to rebuild their adrenals, they find that they can go through menopause so much easier without the medications. Obviously, when you're under a lot of stress or when you're running from a bear, sex is the last thing on your mind, so low libido happens. When you have low libido, the next thing to happen is that infertility. We always like to say that if there's no drive, there's no conception. So having the desires is one reason why it leads, having a desire to have sex leads to pregnancy. And they've seen that in some studies. Also what we're seeing too is when we're under long-term stress, it leads to irregular absent menstrual periods. And so now what's great about functional medicine is I'll actually get to show you in the next slide how indeed your adrenal hormones affect how your adrenal hormones affect your reproductive hormones. So if you notice here, if you look at the top left, that word is cholesterol, if you can't read it. Now cholesterol, interestingly enough, a lot of people don't know this, is the precursor to every one of your hormones. Every hormone in your body is made of cholesterol. So this is why cholesterol is actually super important for women because they do have more hormones and more hormonal needs. Now cholesterol eventually leads to progesterone. Now, interestingly enough, if you look down here at the bottom, though, cholesterol makes progesterone, and eventually progesterone, it's a precursor to cortisol. So what happens is if you're producing a lot of cortisol because you're stressed, you're going to be depleting your body of progesterone, so you're going to have a lower progesterone levels. Now, that's a problematic in our society because what we find is that so many people have low progesterone and high estrogen, and that imbalance creates a lot of problems for conception, a lot of problems in your hormones. So understanding how this stress impacts your hormones is extremely important. Here's another slide. Here's tyrosine. If you notice here in the middle, at the top upper left, there's an amino acid called tyrosine. Now, tyrosine can either make epinephrine and norepinephrine down here, or it can make thyroid hormones over here to the right. Now, what's interesting is if you're making a lot of stress hormones, that's not going to leave as much tyrosine to make thyroid hormones. So this is how your adrenal glands can actually impact your thyroid hormones. Also, if you look here at the epinephrine and norepinephrine, if you're making a lot of those stress hormones, look right above that, you're not making as much dopamine. Dopamine is real important to help improve the quality of your sleep. It also is one reason why it helps you have dreams. And I bet you probably have noticed that when you were young, you used to have a lot of dreams, but now you don't have as many dreams. Well, that's because of this cascade of events here that's leading to a depletion of your dopamine levels. Now, the adrenal glands not only affect your stress hormones and your brain physiology, but it also affects your thyroid hormones. So that's what we're going to talk about next, is your thyroid gland. Now, your thyroid gland is extremely important. The reason that your thyroid gland is so important is because every cell, tissue, gland, and hormone of your entire body has a thyroid receptor on it. This is the only hormone in your body that affects every other function, cell, tissue, organ, gland in your human body. The only one. So when their thyroid becomes dysfunctional, and what we're going to be talking about today is when your thyroid actually starts to slow down, because there are some cases where the thyroid actually speeds up, but that's very few cases. And if that needs to be addressed, I can talk to someone individually about that, but it's not something we see very often. What we normally see is when somebody has a low thyroid. And when that happens, they're going to gain weight all over. Their metabolism is going to slow down, so they're going to have cold hands and cold feet. Their blood sugars are going to go up. They're going to become fatigued. They're going to crave carbohydrates. Their digestion is going to slow down, so they're going to become constipated. They're going to start losing their hair. They're going to have dry skin. It's going to lead to depression and anxiety. If you think about it, when women typically have menstrual cycles, they have mood swings. Well, that's an example of where estrogen and progesterone and testosterone affect your mood, but depression and anxiety can also be affected. Depression is actually one of the things that is a very common side effect of low thyroid. It's something we see in our office. Oftentimes it's missed, and people are diagnosed as having depression, but really they just have a hidden thyroid problem they didn't ever know about. Increase in muscle aches, increase in allergies and infections because the immune system slows down. Heavy menstrual periods. A normal menstrual period should be 5 days long, light red, no clots. And oftentimes what I'm finding, that's not normal in this country, but that's what it should be. What we're hearing more that's more common is 7 days, clots, dark red, cramps, PMS, and it's just not an event that most women like to go through. And that's just not normal, but it is very common. We also see that decreased libido because your hormones are slowing down, because the thyroid affects those hormones as well. You become forgetful and you have high cholesterol. It's not very uncommon for us to see a thyroid patient come into our office that's been diagnosed with depression, so she's taking a depression medication or he's taking a depression medication. They have sinus medications that they're taking. They have had menstrual problems, menstrual history problems, so they take birth control to help normalize their periods, which can actually cause more thyroid problems, which I'll explain more in a second. And they also typically are taking some sleep medications because their sleep starts to fail too. And what's happening is they're just not understanding that just because they're taking a Synthroid in some cases or a medication for their thyroid, it's really not addressing the true cause of the problem still in many cases, which I'll explain what the number one cause of thyroid disease is in a second. And so it's causing the other systems of the body to start shutting down. So these things have to be addressed properly, and that's our goal, is to understand what's the true cause of someone's thyroid problem and help them restore their health. So this slide is going to explain a little bit how this works. If you look here at the right, there's the pituitary gland. That's in your brain. That releases a hormone called thyroid-stimulating hormone, and then it tells your thyroid gland to produce more thyroid, and that's called the T4, thyroxine. But see, T4 is actually inactive. That T4 has to go to your liver, kidney, and your gut. Now I'm going to say that again. If you think about this, your thyroid gland releases T4. It does nothing for your physiology. It doesn't improve your metabolism, or it does nothing until it goes to your liver, kidney, and gut and gets converted to the T3. So think about this for a second. How many times have you ever thought that maybe my thyroid problem is not really a thyroid problem? Maybe it's because my liver, kidney, and gut aren't converting that T into the T3. I bet you've never thought about that until this moment. So that's something to understand that our clinic's really stressing, is that we can't just look at one gland or one organ. You have to look at all the different systems of the body and how they're interconnected. So if you look at this, most doctors only test the thyroid stimulating hormone that's in red and the T4 that's in red, but they're leaving out the T3. They're also leaving out something called the reverse T3, which can be a stress hormone. This is where your body makes thyroid hormones instead of the T3. When you're under stress, it's going to make the reverse T3. When there's inflammation, your body's going to make reverse T3. So understanding this reverse T3 can also be important to understand this picture. Once this T3 is made, it goes to the cell, tissue, organ, and gland and hormone, unless it's stopped by a protein. And the protein that we can actually measure also in our office is called thyroid binding globulin. Now when this, just think about the word for a second, thyroid binding globulin. So what it is globulin is a fancy word for a protein. So it's something that binds up your thyroid gland. It's a protein that binds up the thyroid hormone so that it can't get to that cell, tissue, organ, gland, and hormone and help to create the desired effect. Now what makes this protein go up, or what makes it go up and slow the thyroid down, is cases where we have estrogen. Now many women that I know of are on birth control. Some birth controls actually have estrogen in them. And that can become deleterious because it can actually affect these proteins and make the body make more proteins. And you can simply go home, you can actually right now, you can Google T3 uptake or thyroid binding globulin in association with birth control. And there's been a big link that's been noticed with that. But also with birth control, it's also a toxic substance. So I know it seems crazy to say that hormone is toxic, but I want you to think about this. If you take a handful of, let's say you drink alcohol one day. How much alcohol would it take for you to drink to kill yourself? Well, it would take a lot of alcohol. So that tells you the kind of the level of toxicity of alcohol, how potent it is. But how many ibuprofen would you have to take to kill yourself? Well, it's not that many. And the same thing can happen with birth control. If you took too many birth control at one time, it could actually kill you. So in that sense, this is a toxic substance because it's unfamiliar to the body and the liver have to process it. So anytime we take any medication, it's going to cause some liver dysfunction or liver stress, and that's going to lead to more protein uptakes, and that's what we're seeing in our office. And then also, lastly, adrenal hormones. That stress makes these proteins also go up. So that's something else that we want to look at and understand. Now, the last thing, the most important thing to understand is that the number one cause of thyroid disease, the number one cause, is Hashimoto's. It's an autoimmune disease that actually attacks the thyroid gland and stops it from making thyroid hormones. And the problem with this is that many people that we find in our office, about 60 to 70% of our patients that come in with a diagnosed thyroid condition that are taking thyroid medications, or then we go along a bit further and do more testing, we find out they have this autoimmune disease and they never ever knew it until we diagnosed them with that. And this is a huge problem because if you think about it, this patient doesn't just have a thyroid problem really, they really have an autoimmune system problem. And if you really think about it, with an immune system, where's the majority of your immune system found? Well, the majority of your immune system is actually found in your gut. So you don't really have a thyroid problem here, you have a gut problem. And if you don't address the gut health, the autoimmune disease is going to get worse and worse and cause more problems. And so that's something we want to do, and this is something we do for all of our patients. So for all of our patients, we always test for Hashimoto's. I've ever been tested for Hashimoto's, and I know I don't have an autoimmune disease, but see, the problem is I want to figure out if I do have an autoimmune disease before it becomes a problem. So that's what the testing's for. And the next cause of thyroid disease that we see that's very common, or thyroid conditions, is toxins. And if you see here on the left, the thyroid hormone gland, that's that little butterfly shape, secretes a hormone and it goes to the receptor or to a receptor on a cell. Now, if that takes place, that's what increases our metabolism, increases our mood, improves function of the body. But what can happen, these toxins can get in the receptors and inhibit the thyroid hormone from getting into the receptor. And that's very common today, and especially if you look at different chemicals like bromide and fluoride, those are two of the most common toxins we're starting to see that affect the thyroid and the thyroid function. Okay, and the next hormones that we're going to be discussing are going to be those of the reproductive system and that of progesterone and estrogen. Now, what happens so commonly these days is that progesterone, there's a deficiency of progesterone, and there's an elevation or an increase in amounts of estrogen in people. And remember, as we discussed earlier, stress can play a part in that, and there's some other factors we'll go over here in a second. But when this happens, when you create this imbalance, what happens is our libido goes down. We have abnormal cycles, like we'd mentioned earlier. You're going to have infertility issues, moodiness, irritability, and anger or rage, sleep issues, and anxiety issues. And so often, especially as women go through menopause, they start to develop sleep issues and anxiety as their hormonal levels start to taper off or get more imbalanced. And so getting the balance of progesterone and estrogen are extremely important. Progesterone is more of the relaxing hormone of the body, and estrogen is more of the excitatory hormone in the body. So as these get out of balance, you can see how it can start to create these types of symptoms. Now, once again, even more important than the symptoms is understanding what causes these symptoms. So what research is starting to show us is that a very common cause of estrogen dominance is xenoestrogens, or chemicals that mimic estrogens. We're finding these chemicals now in the lotions that we're using, in the shampoos that we're using, in the deodorants that we're using. You've even heard some commercials now or some advertisements for lotions or shampoos that are paraben or phthalate free, because these are especially important chemicals because they're such endocrine disruptors and they can mimic estrogens. We also know that our body fat can create estrogens. The more body fat you have, the more estrogen you create. The problem with that is that the more estrogen your body has, the more it takes that estrogen and stores it in the fat to protect itself from those high levels of estrogen. Because the higher the levels of estrogen, the more likely we are to develop estrogen-related type of cancers. Another thing we're seeing too is that birth control can lead to an imbalance of estrogen and progesterone levels. And you've even seen this as well. I think we might have mentioned it earlier too, is that what's a very common side effect of when people start taking birth control is that they gain 15 or 20 pounds in some cases because of these imbalances in our hormones. We also know that, like we mentioned earlier, stress can cause a lowering of progesterone, which then makes estrogen appear to be higher, which even if estrogen's normal, but progesterone's lower, that's still an imbalance and that can create these hormonal symptoms. We also know that high insulin levels can create an imbalance in our progesterone and estrogen. I know that many of you aren't probably familiar with insulin, but insulin's the hormone that helps you regulate your blood sugars. So the more sugars you eat, the higher your insulin levels. So let's look at an example of a 13-year-old girl that starts, when she first starts having her menstrual period, it's heavy, it's long, it's crampy, it's longer than 7 days, and it's just not a good event for her. And obviously when there's these types of problems, as a parent, you want help, so you bring your daughter to the doctor, and they recommend for her hormonal treatment, so they recommend birth control. And it seems fairly safe, and it seems like it's a good idea, but it's actually might not be addressing the true cause of the problem. See, if you really think about it, what does the average American eat for breakfast these days? They eat cereal, and most cereals are simply refined carbohydrates that turn to sugar the second that you eat them. Even though they say they're whole wheat, they're still so processed and refined that once they're eaten, it's going to cause a big spike in sugar levels, and that's going to cause a big spike in insulin. And then what do they eat for lunch? Typically, a lot of these younger girls, they like to eat French fries or potatoes or macaroni and cheese. And then for dinner, same thing. They have some toast with some spaghetti, and maybe they might have their first serving of vegetables, which is the spaghetti sauce, which is once again full of high fructose corn syrup. So we see carb, 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 and then they also like to snack on crackers or candy bars and sodas, and so they're just that's found now that the average child before the age of 8 eats more sugar now than Americans used to 100 years ago in their entire lifetime. So we've really started to increase our amount of sugar as well as our refined carbohydrates, which is all going to cause the insulin spikes. Now with this insulin spiking, what we're seeing is that's going to create a situation where the insulin actually goes out and converts progesterone and converts it to estrogen and testosterone. So it lowers progesterone levels and it raises estrogen levels, which then that creates a huge hormonal imbalance. This is why in our office, every one of our new patients, when we do our initial lab work, we always look at the insulin levels because we're finding this hormone is driving so many hormonal imbalances, as well as weight gain. Because see, you have to understand, insulin is actually a growth hormone, and bodybuilders have found out this little trick, and so they've actually started using insulin to bulk up. And this is really problematic for diabetics because many of the medications that some diabetics are taking actually increase their insulin levels, which helps lower their blood sugar, but creates a whole cascade of hormonal problems. So it's really important to understand your insulin levels and what it could be doing for your weight and for your hormones. I love this study, and I think you will too. It says that the tissues of women with breast cancer may have a 10 to 50 times the level of plasma concentration of estrogen. So what are they saying here? That breast cancer is caused because elevated levels of estrogen. This is one known cause of cancer. What's interesting, what I really like about the studies, it says it further. It says this suggests that estrogens are not properly detoxified and therefore will accumulate in breast tissue and increase the risk of breast cancer. So if you think about this, what they're saying is that estrogen's bad, but it's really bad when it accumulates in the body and it's not detoxified. I don't think a lot of people have ever really thought that, hey, maybe cancer is related to our liver function, because isn't that the organ that's responsible for detoxification in our body, one of the primary drivers of detoxification? So this is once again the connection of functional medicine, understanding that, hey, estrogens need to be eliminated and detoxified from the body or can cause cancer. And what's even great about functional medicine is that we have now the testing to evaluate estrogen levels. This is a 21-year-old girl that came into our office, and her mother sent her to our office to have her hormones evaluated because she was, like many, having problems with her hormones and having problems with her cycle. Well, the top three on this top line are the three forms of estrogen. And so we measured for those, and as you can see, 2 of the 3 are very high. But even more importantly, the ones below here, the 16-OH and the 4-OH, these 2, research have shown us, have been linked to causing breast cancer. And interestingly enough, the 2-OH here has been linked in research to show us that it prevents cancer. So as you can see, this young girl right now, with the 16-OH and the 4-OH being high and the 2-OH being low, this is not a good scenario for her to be in. And even more important, the next step is what it's called, where it methylates. If you look here at the bottom right, it says methylation activity is very low. And methylation means that it's the body's liver is taking those estrogens and helping eliminate them. In her case, it's not happening. So those estrogens recirculate in the body and then become problematic. And that's what I love about functional medicine. This is the power of functional medicine, of really understanding what's happening and why it's happening. And unfortunately, so many women think that by getting mammograms that they're preventing cancer. That's doing nothing but looking for cancers. It's going to be too late if they do detect it. This test is a true preventative test, and I believe that every female deserves to have this test run and should know this test to understand this. Because with this information now, we know we can put this particular patient on a specific supplement and products to help the body suck down these higher levels and help elevate this 2-OH and the preventative levels. So we can do true prevention instead of treating the disease. Now, recent research has come out and said that there's really 4 primary causes to breast cancer, but not only breast cancer, but also uterine cancer and ovarian cancer. They're finding now that the hormones are definitely a cause, but they're also saying environmental toxins are also a likely suspect in these types of cancers, as well as our genetics, but then also our immune system, our immune dysfunction. So as we mentioned earlier, the immune system is really, when we think about it, it's really the gut. So with the gut, one of the things we want to understand is that if you look here on the far left, the little villi, those little finger-like objects that are here at the top of the gut, and those are in the intestines. Now below the intestines is the blood, is where the blood circulates. Everywhere there's an intestinal tube, there's also blood that follows it. So the object of the tube is to keep particles and bacteria, parasites, as well as basically the fecal matter from entering our blood. And what happens over time is our intestinal systems become damaged. And the biggest culprits to these are things like antibiotics or NSAIDs. Ibuprofen is one of the leading causes to gut damage that we know of now. We also know that eating foods that really aren't foods, that have chemicals in them, are causing damage to our guts. Alcohol, stress, pregnancy, all these types of things cause these little tears in our intestinal system, which allows particles that aren't supposed to be leaving our intestinal matter going into our blood. Now you can just imagine if you cut yourself and you started to rub dirt on it and fecal matter in it and bugs in it, that would obviously become infected. Well, that's what's happening on the insides of our guts, is that these systems, these tears, are starting to leak these toxins and these particles back into the blood system instead of keeping them out. And when that happens, a whole cascade of responses starts to happen. Our immune system starts to attack these particles just like they're viruses. Now, what happens when you have a virus or a bug into your body? Well, you get an infection of some sorts. Your fever, you have a temperature. Your temperature goes up to try to fight the bugs. You get inflammation. You get swelling in that area, reddening of that area. Well, what happens in your guts, you don't really feel it or see it because it's on the inside of your body, but that swelling and that immune response starts to affect not only in your gut, but your entire body. And so what happens is your guts become inflamed and you start not absorbing your nutrients. Over time, they say that this is one of the major causes of autoimmunity. Right now, we're finding that 1 in 8 people in this country is being diagnosed with an autoimmune disease. And they're wondering, why is that happening? We're starting to see that more and more people have food intolerances and food sensitivities. I mean, think about this. 30, 40 years ago, peanut allergies weren't even existent, really, for that matter. Very rarely, but now you see that just about every school. They also say that this also starts to affect our blood, and our blood-brain barrier. So these toxins, these particles get into our brains and cause inflammation in our brains, and then eventually the systemic inflammation where our whole bodies start to ache and they feel swollen. Now, here's some research that shows that, I want you to understand what this says. It says metabolic endotoxemia. So what does that mean? Toxins inside of the body, and what's that word there? Initiates obesity and insulin resistance. So what they're saying in this article, in this research, is that endotoxins, these toxins that are coming from our gut, are causing us to be fat. Now, obviously, we know that we eat too much food, too many calories, and we know we're not active enough. So we know that's still a cause. But what this is referring to, in essence, is that let's say you have somebody that's eating 1,000 calories a day and that's being active and they're not losing weight and they're developing diabetes. And I'm seeing that in our office too as well. Now, what that can mean in some of these cases is that the person has a gut that's so damaged that it's leaking toxins into the body. And if you read this article a little bit later, it talks about, on the first line, it says, they're seeking an inflammatory factor on the onset of insulin resistance, which is diabetes, obesity, and diabetes. We've identified bacterial lipopolysaccharide as a triggering factor. So I want you to see this study. I want you to look at this. This mouse on the left and this mouse on the right ate exactly the same diet, this is what's great about being in a clinical setting with these lab rats, is you can make them eat what you want them to eat. You can make them be as active as you want them to be active. So both these mice had the same activity level and ate the same amount of calories. Now, if you notice here the difference of the size of these mice, the only difference here in these two rats was the one on the left was injected with that toxin. So that toxin causes obesity, causes insulin resistance, and they also said that that mouse was more likely to have more diseases. Now look at this next study. They're saying that the gut-brain barrier, like I mentioned earlier, when the gut becomes damaged, it leaks into the blood, and that blood goes to the brain. So that's that gut-brain barrier. It's how it's related to major depression. It says the intestinal mucosal dysfunction, so basically the lining of your gut, when it becomes damaged, it increases the amount of toxins that go into the body, and then it says that causes leaky gut, plays an inflammatory pathophysiology of depression. So they're finding that this LPS toxin from the gut is related to depression. And we're starting to see more and more of these types of things coming out in research. So what we do in our office when we look at somebody with a digestive dysfunction, we're looking to see, we do certain testing. We look at if they have high CRP. Every one of you should have this test, and it should be something that's right below your cholesterol levels. It should say C-reactive protein. They're finding that this inflammation in the body is, like I said, it's not just in the gut, but it's systemic, and it goes to the heart. So it's the gut-heart connection. We also see things like homocysteine levels going high when there's a gut dysfunction. We see low vitamin D scores. This is why so many people, despite vitamin D, they can't get those levels up because they still have the leaky gut. Food sensitivities, autoimmune disease, chronic illness, infections, sinuses, allergy issues. People that have bloating, diarrhea, reflux, gas and belching, skin issues, headaches and migraines, depression and anxiety. Let's stop there for a second. Think about depression and anxiety. What do they give again? They give you an antidepressant, which is a serotonin reuptake inhibitor. Where is serotonin manufactured? Is it made in your brain? No, it's actually not. It's actually made in your gut. 80 to 90% of serotonin is made in your gut. So if you have gut dysfunction, you're not going to make those serotonin levels. Serotonin is made from your nutrients from the food that you eat. It's made from B vitamins, B9 and B12 in particular, and tryptophan. So think about this. We don't necessarily have an epidemic of deficiency of depression medications. We have gut issues, serious gut issues going on that are causing these types of problems. It's unfortunate so many people are treated improperly. Systemic pain, like we said earlier, can happen also with this digestive dysfunction. Nutritional deficiencies, where if you have little white spots on your nails, cracking of your nails, ridges on your nails, or little bumps on the back of your arms, that can be all signs of nutritional deficiencies in a poor gut. This is one of the tests that we run in our office. This is a candida test, or a yeast test, that looks to determine if your body is overcome with yeast. This is in particular in the gut. One of the things that we see in our office is that at about 60 to 70% of our patients is that they have this hidden yeast overgrowth in their gut. What happens is that means when the patient eats their food, and instead of absorbing the nutrients, the yeast eats the nutrients. So now the patient starts complaining of fatigue, they complain of hunger, they complain of bloating, gas, and they crave carbohydrates and crave sugar. So killing this yeast, or getting this yeast out of the body, or ridding this body of this yeast, is going to be so important to people regaining their health. And oftentimes can be their symptoms can mislead their doctors into thinking or believing that they have a thyroid problem or a fatigue problem that's really just undiagnosed yeast. Another test that we do in our office is a food sensitivity test. A lot of you are familiar with when you go to your doctor, they pick people with these pins and determine if they have food sensitivities. Well, that's an immediate reaction. That's called an IgE testing. Now, this is what they call an IgG testing. This means that after you eat the food, it can be up to 24, 48 hours, or even longer sometimes for your body to have an immune response. Now, you can tell from this patient's case, there's a lot of reds on here, a lot of 3s, 2s, and 1s. 3s are severe, 2s are moderate, 1s are mild. Now, what's important to understand is that this patient doesn't necessarily need to eliminate all these foods from their diet, because that's really not the problem. Really what the problem is that hyperpermeability that we discussed earlier. When you have the gut that's damaged, it's going to leak foods through the intestines back into the blood and cause the body to have that immune response. When that happens, that creates that inflammation, that creates that slowing of the metabolism and the fatigue and the overall systemic inflammation. So our job with this patient, for example, if you look at the top left, you see their date of birth is 7/11/1954. This test was done in 5/15/2013. Now this is the same patient 4 months later. So if you look at that, you'll see that the patient's their immune system is calmed down. It's at ease now. And that's extremely important, especially when you're dealing with patients that have autoimmune disease and patients that have, especially the autoimmune disease of the thyroid, is to get that immune system to be rebalanced. So with this patient, she was suffering from low thyroid. She had eczema. She also had psoriasis as well as lupus. So she had a whole host of autoimmune diseases that she was taking steroids for, anti-inflammatories, pain pills. But really what happens when we get that gut healthy, everything else in our life started to click. Another test that we can do too in our office is something that we can look for nutritional deficiencies. If you look here at the B vitamins in the middle here, you can see there's a lot of nutritional deficiencies. Well, we know when we're stressed, our bodies are depleted of B vitamins. Well, this is that same patient we just showed you before with the Candida test and with the food sensitivity testing. So it's just showing that this patient's not absorbing their nutrients, which is then leading to that fatigue that nutritional deficiencies have caused. Now, if you remember from earlier when we talked about the 21st century and how the environment's changed, the pollutants have changed, the pesticides, the herbicides, the stress, the trauma, the, the pharmaceutical industry, the cosmetic industry, we're just being bombarded right now with tons of toxic stress. All this has to go through our liver. Our liver is a 4-pound a metabolic powerhouse. It's responsible for over 500 metabolic functions. And one of the primary functions of the liver is actually to help the body heal itself. Now here's a good example. If you look here on the far left, that's you when you're born. You're a nice, healthy baby, newborn baby. Now this is what your body's made up of, is trillions and trillions of cells. Now what happens over time is these cells are attacked by things called free radicals. And I think every one of you probably heard of free radicals. And I think you probably heard that free radicals cause cancer. And as you can see over time, if these free radicals are damaging the cells, eventually on the far right, that's what you have is you have a cell that is oxidized, that's becoming more prone for cancer, that it was cancerous. But realistically, this is the aging process. We start out here healthy. As life goes on, we're exposed to these free radicals. Free radicals come from digesting food, come from exercising, from burning calories, from toxins, from the environment, from our body's hormones, the metabolites of the hormones, the waste products. Everything in our life creates an exhaust, a waste. That exhaust and waste causes us to age. This is why people that smoke, that don't sleep enough, or under a lot of stress, they have more free radicals than others. That's why they age faster. You've heard some people age faster than others. Well, that's because of these free radicals. Now, what happens over time, these free radicals damage the cells. Now, if you look at the cell on the far right, I want you to think of something. What would this person feel like? That's right, they'd feel like crud. Also, how much energy would this person have? How's this person's thyroid going to be functioning? How's their digestion functioning? How's their immune system functioning? So no matter how many hormones we give this patient, no matter how many drugs we give this patient's not going to feel any better. And that's what's so important to understand with our office, is that we don't just treat the symptoms of the patient. We want to ensure that the liver is functioning properly, getting rid of these free radicals so that we're reducing the damage of these cells so the body can become healthier. This is actually, I don't like the word anti-aging, but this is helping slow the aging process. And then also with our patients that have a lot of this damage occurring, we want to reverse some of that damage that's been occurring. Now, what's interesting is the more damage you have in these cells, the higher your cholesterol is going to be. I want you to think of something. Earlier we talked about that every hormone is made of cholesterol, but about 90% of all cells in your body, one of the precursors to it is cholesterol as well. So the more damage you have in your body, the higher your cholesterol is going to be, because the body's going to try to fix those cells. So let's do an A or a B. Let's do a question for you guys. A, the body makes more cholesterol in an attempt to kill itself. Or B, the body makes more cholesterol in an attempt to heal itself. That's right, it's got to be B. The body's not trying to kill us, but it's actually trying to heal us. And really think about that for a second. So all this time we've been so terrified of cholesterol, and there's a good reason why, because that's what we find in the arteries that are clogged. But why is it stuck in the arteries in the first place? Well, the only reason cholesterol is going to be stuck in an artery is if the artery has inflammation, if it's damaged, and if there's free radicals that are causing damage to those arterial walls. If the artery walls aren't damaged and there's no inflammation, the cholesterol is just going to hit the wall and slide down and keep moving. So what we're finding now is that inflammation is indeed the cause of heart disease, is indeed the cause of cancer. And this is what we're really more concerned about, is inflammation and this free radicals. So when the liver gets backed up, when it becomes bogged down because of the leaky gut, because of the toxins, because it just can't keep up with all that's happening to it, we start having troubles. These toxins start to accumulate. We start having troubles concentrating. We become forgetful. We develop headaches and migraines. I want you to think about something. When you get a headache, what do? You take a non-steroidal anti-inflammatory drug. Anti-inflammatory drug. So it's the inflammation that's occurring from the gut that the liver can't keep up with, that's accumulating in the brain, that causes the headaches. It's not a deficiency of Excedrin. It just doesn't make sense that we're just taking Imitrex and these other drugs to try to prevent headaches or migraines, when truly we've got to get to the cause, and that means improving the gut health so that then therefore we can improve the detoxification of the body. then we can start to see symptoms go down. We help so many people eliminate their needs for headaches or headaches and migraine medications. People that have overaccumulation of toxins start to have tremors. They wake up between the hours of 2 or 4 o'clock in the morning when their bodies start detoxifying. They have an increase in allergies, skin issues, and acne, just like the gut. Because the gut and the liver can be shown, the health of those two organs can be shown by the health of your skin. Your skin's a direct reflection of the health of your gut and your liver. And then over time, if the liver becomes too dysfunctional, we start to see the cholesterol go up. We start to see high blood sugars, and we see an increase in muscle and joint pain. What's a side effect of a statin drug or a cholesterol drug? One of the main side effects is muscle and joint pain and muscle weakness. I have a patient that's in my office, and she's a medical practitioner, and she's actually an ER nurse, and she refuses to go on statin drugs because she believes they lead to weakness, and that's why she thinks the nursing homes are so full of so many people now, is because that 1 in every 3 Americans, like I mentioned earlier, is on a statin drug now, which is going to lower their cholesterol levels, which also, though, lower an important enzyme called CoQ10, or a nutrient called CoQ10, and that's really important for muscular function of the body, especially that of the heart contractions. So there's even some researchers that are coming out now that are saying that, hey, these cholesterol drugs could be leading to more potential problems than help. So we have the ability in our office to measure liver function, measure toxins and detoxification markers. And one of the biggest tragedies I'm seeing today, and especially in today's healthcare system, is that these toxins and these environmental factors are being completely ignored. I mean, if you go to your doctor and you ask them, hey, do you think that toxins could be causing my thyroid problem? Or, hey, do you think toxins could be causing my sleep issues? I mean, they're going to look at you kind of funny. And I want you to understand something. It's not because they're being vindictive or they're being deceitful they just simply don't know. Okay, it's kind of like if you came to my office and you said, hey, doc, I think I needed appendicitis. What kind of a surgical incision would you need to do to perform that? I would look at you kind of crazy because obviously you've come to the wrong doctor asking the wrong questions. And that's really what this is, because most medical profession, obviously they got out, they went to school, they worked hard to help people, but they've only been taught what they've been taught. And I've only been taught what I've been taught. So you can't be angry or frustrated with some of these people because they don't know these things. They just don't know. And I don't want to pretend that I know everything as well, but I do understand one thing. We help a lot of people. And the reason we're able to help them is because we do a little bit more digging and we're a little bit more open-minded to what other true causes are out there and what the true causes are out there, what research is showing us. And so when you look at patients today, they're doing what they're supposed to be doing. They're taking their medications, they're trying to eat less, they're trying to move more, but they're still suffering. And every one of these patients I'm about to go over were all patients that were like that. They all tried really hard to be healthy. They weren't the kind of patients I like to say that couldn't get their hands out of the Cheetos bag. These are patients that really worked hard and really wanted to be well. They just couldn't figure it out. This first patient's Roxanne Lewis. And with Roxanne, she came to my office initially. This was back about 7 years ago, actually, when I was practicing chiropractic and I was just getting into functional medicine. She came to my clinic because her right hip hurt. And I remember when I talked with her, looking at her health history, I thought, my goodness, she needs so much more help than just this right hip. And so when I told her, I was like, Roxanne, I think I might be able to help you with your issues. And she looked at me kind of funny with a cockeyed head and kind of looked at me with the disbelief, like, yeah, right. And the reason she did is because, she'd been to the best doctors. She'd went to Emory University in downtown Atlanta, and she'd spent thousands upon thousands of dollars and years of her life trying to get answers to her problems. She estimates that she spent over $50,000 of her own personal money. This is because she had a $5,000 deductible and a 20% copay in-network or a 30% copay out-of-network. And she was desperate looking for help. And if you read her testimonial here, she said, I wasn't able to sleep more than 2 to 4 hours without waking up. I was unable to go back to sleep. And if you think about what we talked about today, is what systems of the body you're thinking when you think this. You're thinking adrenal glands, and you're also thinking liver. And so that's what I was thinking, adrenal glands, liver. My hormones and emotions were out of whack. My menstrual cycle was 6 to 8 days long, abnormal heavy, and every 2 weeks. Now, of course, traditional medicine is going to say, well, if you're having a cycle every 2 weeks and they're 6 to 8 days long, that's a hormonal problem. And that they were almost right. It was a hormonal problem, but it wasn't really that her hormones weren't. It was that her hormones were out of balance, but the problem why they're out of balance so far is because her liver was so faulty. And I was pretty sure that's what was happening with her. And I wasn't sure though, because I don't ever guess. I always test. And so I told her, I said, why don't we order this test? If it comes back positive, then you need to start care with me and see if I can help. So thankfully, after 2 weeks of waiting, I remember when I got the envelope, I was so scared to open it because I really wanted it to be what I thought it was going to be. And I wanted to show her that show I was on the right track. Well, thank God the results came back and it showed exactly what I thought it did. It showed that her body was not metabolizing or eliminating estrogens properly. So after only working with her for 2.5 months, she says that her life and her health are so much better now, she said. I sleep the entire night, 7 to 8 hours uninterrupted. And I don't know about you, but if you've ever been a person that hasn't slept for more than 2 or 3 days in a row, it starts to really take its effect on you. And it makes you very depressed, very anxious, and it really starts to make you very emotional. And that's exactly what was happening with her. So just imagine the first night she slept 7 to 8 hours. And then she also said, my menstrual cycle is completely normal now. For the first time, I feel like I can conquer the world again. It's amazing. All of this in just 2.5 months. And the only reason we're able to do that is because of the simple principles again. We take out of the body what it doesn't need and put in the body what it does need to function good. So we took out those estrogens, the bad ones, and we put into the body what it needed to help to detoxify those estrogens. All right, and our next testimonial is going to be Miss Mary. And I tell you, Miss Mary has a great story, and I think you'll find it very motivating, inspiring, and quite heartwarming. So please enjoy, and we'll talk more about her case afterwards.
Before I came to Integrative Wellness Centers, my health was a mess. I had menstrual problems, I had thyroid problems, I had problems with my ears, significant problems, things that made it so I couldn't drive because I was dizzy. I ended up getting diagnosed with Meniere's disease, which is an inner ear condition. I have had ablations, which is a menstrual trying to suppress heavy bleeding. And my thyroid medicine was being increased almost every other month for about, well, I shouldn't say every other month, probably every 3 to 6 months it was increased for at least 2 years. And so, yeah, I was struggling, and I was trying to grasp at things and try to figure out ways to become healthy, and I felt like none of it was working, and it was very difficult. I go to my doctor, and my doctor looks at me and says, try this, and it feels like it's something he's read about, and maybe it could help. Here, it's, no, this works, and the diet, it's, your blood is drawn, and there's other things that are proven to show why you're doing what you're doing, and it feels like there's answers. There's why I feel bad, there's how to fix it, and there's support and a means to do it. It's been under care for 9 months now, and my health now is tremendously different. I have control over my physical health. I can say I have control. I'm not dependent on the doctors. I'm not dependent on anything. I am in control of my health. I feel so much better. My thyroid has stabilized. I haven't had an increase since I started this program. My menstrual cycles are completely normal. My ears are completely under control. It's to the point where I almost feel like my ears are a non-issue. My family, I don't even think realizes certain things. Like the fact that I wake up in the morning now and I go snuggle my kids because I have the energy. I can actually go to bed and wake up in the morning. That hasn't happened for 15 years where I would just wake up. I always had to wake up to an alarm. And even on the days when my alarm went off, I was exhausted. And now I get up in the morning and my alarm still goes off, but I wake up and I'm awake and alert and alive and I'm ready to go, and I get up and I go into my kids' bedrooms and they're still sleepy, but they're kids. My husband, I know there's just a renewed sense of energy in our entire family because it's not just me dragging through life, it's me enjoying life. Emotionally, I can't even explain how much this means to me and to my family. I owe you so much.
What's great about Mary's case, her story, is that We actually met when our kids were playing hockey. We were out ice skating, and I was teaching my sons how to ice skate, and she was out ice skating as well. And we kind of started talking to each other. And I told her I was practicing functional medicine and just moved here and was starting a new practice. And she told me that she was recently diagnosed with Hashimoto's, and so that she had been doing a couple things that she was trying in order to see if she could get help. And I told her, well, if she ever needed my help, come back and see me sometime or come to a seminar. And actually, it was a year later I saw her at one of my seminars. And, what's so great about this is, this isn't one of these fly-by-night, get fixed quick schemes, and it really frustrates me that there's so many things out there that are so deceptive, weight loss programs where you eat 600 calories a day and you do magical drops and you lose 40 pounds in 40 days. And I mean, all these gimmicks and scams and hoaxes. And, if you really look at this, though, and you look at what we're doing for people, we're truly making an impact because we're teaching them what it is that's wrong with them, why it's wrong, and what they can do about it in order to improve their health so that they can make long-term impactful decisions based on their health that are going to impact them deeply. Because we know that Mary had an autoimmune disease that was affecting her thyroid, that changed everything for her and the way that we approached her care. It wasn't just some cookie cutter approach where we just said, oh, it's a thyroid problem, let's just put her on iodine and give her some selenium and some zinc and voila, she's fixed. It's not that simple. We have to do testing. We have to understand what the body's doing, what it's going through in order to help people really get to the root cause of their problems. These are real people with real problems that are getting really great results. This next patient is Claire Chalmers, and I'm sorry, Chris Chalmers, and she came to our office, and one of the things about Chris is that you wouldn't know by looking at this picture, but she'd been exercising an hour a day, 6 days a week for an entire year, and she was a bit frustrated because she had only lost 5 pounds in that year. But it was funny, she went to her doctors and they actually congratulated her and told her that everything in her blood work was looking great, she was doing great, and just continued doing what she was doing. So she was moving more, she was eating less, and really she was doing better than she'd done in years, but she just wasn't really coming around. She still had some digestive problems, some hormonal problems, and some fatigue problems, but she didn't really think it was anything wrong. She just thought that was kind of normal for her. Well, when we did some testing, we discovered that she also had an autoimmune disease affecting her thyroid. If you look at these levels here, the thyroid peroxidase antibodies, her levels were 125. Well, 34 is normal, so she's 4 times the level. I want you to see her testing. This is about a year and a half, 2 years later. We did some follow-up lab testing, and you can see now her antibodies are only 35, and 34 is the top of the mark. So she's only 1 point away from not even being able to be diagnosed anymore with an autoimmune disease. And that's what we see with some of our patients. We actually see the antibodies that were attacking the thyroid disappear on the lab work, and it shows up now that they're no longer have an autoimmune disease. Now, the thing about it doesn't mean that it's gone. It just means it's dormant at the time, that you've balanced the immune system like we talked about earlier. You got the gut healthy, and you taught the patient what they needed to avoid and how to live their life with this autoimmune disease instead of just ignoring it and covering up with symptoms and medications. Well, this is her after 4 months of being to care with us, but she was still exercising an hour a day, 6 days a week. She lost 50 pounds in 4 months. Now, please don't come to my office and think you're going to lose 50 pounds in 4 months if you're not going to put forth the effort. Like I said, she was exercising an hour a day, 6 days a week. So she was committed. But the difference for her is that she discovered why her body wasn't losing weight initially, why she had the bloating, why she had the fatigue, why she had the hormonal imbalances is because of this autoimmune disease. This is actually, if you remember earlier, we showed you the hormones slide of how the different metabolites of the estrogens can cause cancer, ones can prevent cancer. Well, that was her daughter, Claire, and this is Chris. Now, this next slide is actually her husband. Her husband was a full-blown diabetic. His name is Ray. His A1C was 11.1. His blood sugar was 286. If you read down here now, 8 months later, my A1C is 5.5. He's completely medication-free now, and he's no longer diabetic. Actually, if you look at that picture next to him, that's a letter from his insurance company reminding him that he should be continuing taking his medications. I don't know why an insurance company is so concerned that if he's taking his medications or not, but definitely something's going on. So what we're seeing in our office then is that a lot of people go to their doctors and they're told everything is normal. And a lot of doctors, that's what it is. It's black and white. That you either have a disease or you don't have a disease. But really, that's not what health is. In health, you're either moving towards a disease or you're moving towards health. And so we don't really like to look at things as black and white. We like to look at them almost in a sense that it goes from green means good, yellow means caution, red means not good, and then black means it's broken. And so if I want you to look at this patient came into our office and she was told by her doctor that everything was great. And if you read at the top, it says call and tell great. Well, when she brought her lab work in to discuss it with me, I reviewed her lab work with her, and this was just during the consultation. I looked at it and said, well, everything looks great except for the fact that you're diabetic. And she almost fell out of her chair. Right there, if you see the glyco, and it says it's H, 6.5, that means that her blood sugar levels, her accumulated blood sugars for a 3-month period was of a level of a diabetic. What's interesting is she was complaining of overwhelming fatigue, and she was also having trouble sleeping well. And those are two common symptoms of people with diabetes. So even in this case where it's a black and white, the doctor ignored it. And quite honestly, I don't think the doctor ignored it. I believe that the doctor's just so used to seeing it now that she wasn't alarmed by it because it's just so common. This patient, this is one of the lab tests that we run. A lot of the markers that we discussed earlier throughout the seminar are in this test. Not all of them, but a lot of them are. And this patient was told that well, first off, let me back up. They were complaining that they were very emotional, they were weepy, that they had no zest for life, that he was suffering from erectile dysfunction and just didn't really have any urge at all anymore. And when I actually sat down with him during his consultation, he told me, he says, you know, Josh, Dr. Shields, I actually feel like one of those dogs that's dying that just wants to go off into the woods and be left alone. And what's interesting is he went to one of those bioidentical doctor's offices, and I think you've seen them before, the low T doctors. And a lot of these doctors are getting to this model because it's a cash model, and what they're doing is they're basically selling hormones on for a cash value instead of having to go through insurance companies. And so he went to one of these doctors because he was so desperate for help, and the doctor told him, lo and behold, he had low testosterone. So I think it was about 10 to 12 months into this process, they'd finally gotten his testosterone levels back to normal. Now, mind you, this was $500 a month to get his testosterone levels back to normal, but he still had no zest for life, had erectile dysfunction, and still felt miserable. When I did his testing, it revealed, if you look here, there's a lot of stress in that system. A lot of the reds, that means things are definitely out of balance. And when I looked at this blood work, I said to him, I said, you know, not only do you feel like you're dying, but honestly, looking at your blood work, it looks like you're dying. And I said, the problem is that everybody's trying to fix you by giving you hormones, but realistically, you don't have a hormonal problem. You have an overall health problem. And so this is him 4 months later. And you can see now that his body's a lot less stressed physiologically, and his body's much more at ease. And, you know, it's funny, not funny, but what's interesting now is he's lost about 45 pounds. He actually looks completely different than he did when he first started care. But the best thing is that he's got zest for life again. He feels like he can conquer the world again. And his wife is extremely happy now with some of the changes is going on in his life. And this is a guy at 52 years of age that felt like he was dying. And I saw him just the other day, and it was interesting because he came into the office and he says, he was kind of frustrated. He says, you know, it just kind of pisses me off a little bit that, you know, I go to these doctors, I go to endocrinologists, and nobody told me what was really happening. He goes, you know, they just kept trying to give me another pill. He goes, why didn't they do what you did? And I said, you know, unfortunately, they're not in the business of, I know it sounds like it, they're not in the business of healthcare. They're in the business of patching up problems. They're really good at fixing things when they're broken, but they're not real good at fixing things so that people become healthy. And so really that's what our office is about. Like I said, real people getting real results. Now, so I hope by now that after watching this far, if you've listened this far, it's pretty amazing in the first place. But if you have, I want you to know I'd love to invite you to come into our office and talk to find out if indeed we can help you. So what we're going to do is we're going to sit down with you and we're going to have your first visit. We're going to determine if you're a good candidate for our care. So we'll sit down, we'll talk with you. If we believe you're a good candidate, we'll then talk to you about what testing I recommend, and typically only recommend one test. The first test can be anywhere between $100 and $200, depending on what you're going to need. I'd also recommend you bring any of your old lab work with you too as well. Not that it's going to reduce any of the testing that we're going to do. It's just going to give me a better understanding of what additional testing I may need to order that first visit. We'll send you out of the office with that lab work. It'll be about 6 or 7 days we'll get the lab work back. We'll call you back for your second visit. Your second visit, where I'm going to review your lab results with you. I'm going to let you know if indeed I can help you, what's wrong with you, how long it's going to take for me to help you, and then also any expected cost as well, and any additional testing I'll need. I will need additional testing, but the first test will help you understand what additional testing I'll need. You know, one of the great things about our office is that we have several different options to help make things more affordable for our patients. And what's important to understand is that we're here to help you, and a part of that help is to figure out the best way to make this affordable for you. So and people are always asking, well, how much is it? Well, first off, it's hard for us to say exactly how much it is because I don't know you and I don't know what's wrong with you. It's kind of like asking somebody to remodel your house, but they don't really know what needs to be remodeled. So the first step is to figure out what's wrong and what we're going to be able to do to help you. I can tell you that our plans of care can range anywhere between $800 and $5,000, just depending on the length and the severity of your condition and how long it's been going on. I want you to see something. This is a room of patients that we had a dinner at Aunt Yama's quite some time ago, but this is 40 of our patients. 40 of our patients invited 80 of their friends. This is 120 people. Now, why would 40 of our patients invite 80 of their friends to come and listen to me speak on health? Because we made a difference in their life. We changed their life. And that's what I'm hoping you understand by now. This is not some gimmick, not some scam. This isn't some quick buy night, take a pill and heal all your ills. This is real care for real people. We find natural solutions, long-term solutions for people to get to the root cause of their problems. And when you transform their life, they'll do anything to help others do what they've done too as well. So I'm going to leave you in my last slide is that you won't change how you feel until you first change how you think. If you continue doing what you've done, you're going to continue getting the same results. So I just ask that you venture out and you take that first step and you schedule that first consultation with us to find out if indeed I do believe I can help you. And I promise if I don't believe I can help you, I'll refer you to somewhere else. Have a great day. Thank you. God bless.